Good afternoon. This is Module 4 discussion. We'll be talking about depression in children and adolescents this week. So, as we know, depression is a major issue for all age groups, but we'll be talking from children as young as 3 up to adolescents. Early detection, diagnosis, and treatment are the critical steps for optimal health outcomes. So the 3 questions that we will be addressing. What are the common signs and symptoms in children and adolescents experiencing depression? We're going to explain the pathophysiological mechanisms that contribute to these assessment findings. We will also explain the pharmacological action of drugs commonly used in the management of depression in children and adolescents. So as we know, during childhood and teenage years, that it's a great time for change and personal change and improvement. So as boys and girls, they are forming an identity apart from their parents, are grappling with gender issues, they're emerging their own sexuality, they're making independent decisions for the first time in their lives. So this is very stressful. Depression in adolescence frequently co-occurs with other disorders such as anxiety, eating disorders, or even substance abuse. It can also be at increased risk for suicide. So signs and symptoms. Signs and symptoms of children and adolescents experiencing depression. So there might be anger outburst, anxiety, as we spoke of earlier, chronic pain, clinging to parents, decreased energy, maybe helplessness or hopelessness, feeling of melancholy, maybe even feeling tired, getting in trouble at school, inability to concentrate, maybe even the inability to experience pleasure or excitement when doing activities that would or should be pleasurable for someone at the same age. Maybe the child or teenager or adolescent is having insomnia or oversleeping, maybe even memory loss, refusal to go to school, drug abuse, maybe even weight loss. They could even be sulking or what we call pouting. All these can occur as signs and symptoms of depression. The pathophysiological mechanisms that contribute to these assessment findings. So these mechanisms, there are certain mechanisms contribute to the assessment findings. Depression has been associated with abnormally low levels of neurotransmitters, such as norepinephrine, serotonin, and dopamine. All these are feel-good hormones. Certain hormonal abnormalities such as these neurotransmitters, can contribute to depression. Also, some hormonal abnormalities is in the endocrine system. The hormone cortisol. Cortisol is released in stressful situations. So it is thought that when it is released, it reduces serotonin, bringing on symptoms of depression. There's a genetic component of major depression. Our book states that 1.5 to 3 times more common that is depression in people that have a first-degree relative with depression. There is some environmental causes that such as stress at home, school, loss of a loved one, sexual or physical abuse. All these can occur and the same mechanism as we spoke of before, release of cortisol and in return reducing serotonin. So explaining the pharmacological action of drugs commonly used in the management of depression in children and adolescents. A lot of the research that I found talked about the black box warning. That is, it is a warning label on all antidepressant medications to alert the public about the potential increased risk of suicidal thinking or attempts in children and adolescents taking antidepressants. So there's a marker on the effexor. In fact, it warned against it being prescribed to children, and the USDA had issued the same warning for Paxil, which is common for someone that has depression to have that prescribed. So there's some other questions that research has pondered to whether the older tricyclic antidepressants are effective with children. Most professionals will recommend therapy as the first line of defense, or talk therapy, to talk through the problem. But in a case where the child is severely depressed or suicidal, medication might be the best option. You'll have to weigh the risk and benefits. In 2005, the FDA adopted this black box warning label on all antidepressant medications to alert the public about the potential increased risk of suicidal thinking or attempts in children or adolescents taking antidepressants. In 2007, the FDA proposed that the markers of all antidepressant medications extend the warning even to young adults up to through the age of 24. Like I said before, it will be the weighing of risk and benefits. Certain drugs that are used for depression are like SSRIs or MOAIs. We talked about like Paxil and drugs like that. Depending on the patient's current condition depends on what type of antidepressant, whether it be atypical or typical. But as I said, the FDA has really published this black box warning as to saying that it might even possibly enhance or increase the risk of suicide thinking. So medications isn't the first option for adolescents and children. That therapy should be tried first. I attached my resources to this video. Thank you.